Let's focus now on Central Africa, where authorities are struggling to contain an Ebola outbreak. Health officials say a rare strain of the virus has caused more than 300 suspected cases and killed 100 people. The outbreak began in the Democratic Republic of Congo. Eastern Ituri province has been identified as the epicenter, and it's where most of the cases and deaths have been recorded. Ebola is caused by a virus caught from wild animals. It spreads from person to person when you touch infected body fluids. Early symptoms include fever, muscle pain, fatigue, headache, and sore throat. As the virus progresses, patients start to see vomiting, diarrhea, skin rash, and bleeding. The average Ebola disease case fatality rate is around 50%. Well, let's get more now from Professor Salim Abdul Karim, the chair of the Africa CDC Emergency Consultative Group and director at the Centre for the AIDS Programme of Research in South Africa. Thank you so much, Doctor, for joining us. You know, it does feel slightly like a déjà vu, like we've been here before, just when the world thought that they'd somehow seen the end of Ebola. It now feels like it's made some kind of comeback. Just bring us up to date.
Good evening to you. Yes, it does feel that way. When we think back to 2014 and the huge pandemic that we saw, where cases started in the DRC and then spread to Côte d'Ivoire and multiple countries in Africa, and then across the world. When we look at the current situation, we are now dealing with a different strain of the virus. This strain is called the Bundi-Bujo strain. It's not the same as the Zairian strain that we saw previously, but clinically it presents in a similar way. The challenge with this particular strain is that we don't actually have widely available diagnostic tools for it. It's not easy in the lab to diagnose it because its unique characteristics make it difficult, and the current usual Ebola tests that we have don't work against it. And in the same way, we don't have treatments for it, and we don't have any vaccine for this particular strain. So the thrust of our efforts right now are to identify each and every case and to do contact tracing and use the standard public health measures of contact tracing, isolation, to limit the spread of this particular virus. And recognizing that, we're now on the back foot because this virus has already been spreading for something like a month or two.
Just help us understand those challenges a little bit more, because the areas where we understand it's spreading is a conflict area, and so how difficult is it then to get to that area, for health workers to operate in that area, and as you say, to try and contain it then?
Absolutely. There are many challenges. The logistical challenges are just enormous. The nearest airport is in Entebbe, and it's 450 kilometers by road to get to Ituri province. And it's right at that part of the DRC that's close to South Sudan. It's close to Uganda. And it's also a bit of a commercial traffic area. There's people come there to sell their wares and so on. So there's cross-border flow that's quite substantial at that point. So if we look at what is the current situation? So this morning's report from the Africa CDC that we received is that there are 393 suspected cases. There are suspected to be 105 deaths from this disease. The problem is that we don't have laboratory confirmation that any of them are actually this Bundi-Bujo strain of this particular Ebola virus. And that's been our big challenge, that the laboratory capacity, because of the difficulty in diagnosing it, has held us up. Now that we are expanding the capacity to test for this virus, we can now focus on the task at hand, identify cases. That's key. If we can do that, we can contain it, recognizing that it's already spread to Uganda, but with good public health measures. And remember, the DRC has dealt with 16 or 17 other Ebola outbreaks, it knows what to do. It has experience. It has a superb research group, outstanding. So I think we're in good hands with the people on the ground, but there's a lot more that needs there. We need to provide them with the support that they need to get this under control before it starts spreading to other parts of the world.
And that's the point I wanted to pick up on, Doctor. How worried should people be that this will start to spread, even though you say, Uganda, for example, has the facilities, has the experience to be able to contain this and has the facilities. But as we've seen from the past, and you referenced 2014, it did start to spread at a rapid rate across the continent and then beyond. How worried should people be about that repeating?
The scale of, should we be worried like COVID-19? The answer is no, because it's not a respiratory virus. It doesn't spread in that kind of way. Should we be, as not concerned as we were with, say, Hunter virus? No, this virus spreads far more than Hunter virus does. So it's somewhere in between those two. And overall, what can we glean from our 2014 experience? The first is that we can expect that there are going to be many more cases, and there will be isolated traveler cases identified in other parts of the world, including the UK, because the DRC is a connected country. There are many people, huge mining industry, there are many other industries, people are flying in and out. And so we can expect that there will be, as they've already been in Uganda, travelers from Ituri province who've been there and who had the infection. And the problem then becomes that once there is an imported case, the big challenge becomes reducing the risk of the infection in the healthcare workers. Healthcare workers comprise, one of the most important risk groups. In fact, it's a huge part of the number of current suspected cases actually are healthcare workers, because the virus itself, remember, the original virus comes from fruit bats. And the person who got it, or the persons that got it originally from the fruit bats, those were just one or two individuals. That's a zoonotic transmission. But that person then came to a hospital. And the first case we know of from the 24th of April was a nurse in the hospital in Ituri province. So it's healthcare workers that we really have to care about, and protective equipment for them, ensuring that they have all that they need to protect themselves is going to be critical.
Doctor, we're really grateful for your time. Thank you very much for joining us.
Pleasure.